When I see a patient coming to my office, a lot of times a very basic exam, something called digital rectal exam, or simply put rectal exam, is performed. What do we do with that is to make sure we look at the texture of the prostate. Prostate is a walnut organ which is sitting deep in the pelvis area. It's connected to the bladder, connected to the urethra. So a simple rectal exam will show the size of the prostate, the texture of the prostate, and make sure that there's no firmness. It should be smooth. We look for a lot of information there. Getting a simple urine test, finding out whether there's any infections or leukocytes or any blood in the urine. Is there any sugar? It's amazing how from a simple urine test we learn about whether you are diabetic or not, whether you have ketones, are you fasting or not. We'll learn about your kidney function. We'll learn whether or not you're drinking enough or specific gravity and how diluted or concentrated urine is. So a simple urine test, digital rectal exam, getting a basic PSA test, prostate specific antigen, and the PSA test is a test that we use for screening for prostate cancer. A lot of times if you're at high risk, if you're an African American, if you have genetic factors, family history of prostate cancer, we like to know the first PSA at the age of 40 and basically follow this every year and have a discussion with your urologist. We look at the trend of this test and find out if it's a real rise or not. And today with advances that we have, we don't need to jump into these random biopsies and hurt the patients. We're very fortunate that this center here in New York was one of the first centers that had the MRI fusion or targeted biopsies. The old-fashioned biopsy for prostate cancer was random biopsies, and you would miss a lot of cancers just using the ultrasound. Today, with the use of the MRI, finding exactly where the target is and the lesion is, we're able to find these cancers and be able to treat you effectively. So what I'm trying to say is that the technology is changed and it's all to improve your quality of life. But you have to come in and get screened.